Welcome to Protecting Young Minds. This is the premiere of our Fresh Takes on Prevention webinar series. Each month, we bring fresh takes on prevention topics so that we can educate and introduce prevention strategies that can be used by anyone, anywhere, because everyone plays a role in prevention. My name is Juliana Kleinsmith. I am the program director here at Prevention Action Alliance, and PAA is a statewide nonprofit with the mission of saving and improving lives through prevention education, such as this webinar, and advocacy. Please visit our website for upcoming Fresh Take webinars and other events as well. So today we have with us Kayla Zawislak, who is the Director of Patient and Family Services at Addiction Policy Forum. So I'm going to let her now talk about herself and what she is going to offer us today for prevention education services.
Thank you, Juliana, and welcome everyone. And thank you so much for being here today. I sincerely appreciate you taking the time in your morning to be here. So I'm Kayla Zawislak. I'm the Director of Patient and Family Services Engagement at the Addiction Policy Forum. I'll give you a little background on Addiction Policy Forum in just a moment. And I have been with Addiction Policy Forum over 8 years, maybe it's almost closer to 9. And I am a licensed clinical social worker, certified alcohol and drug counselor, and then I'm actually a person in long-term recovery. So this topic is really near and dear to my heart, especially as a mother, providing prevention resources, and things that actually work and educate folks. So to tell you a little bit about Addiction Policy Forum, so we are a nationwide nonprofit organization, and what we're dedicated to is eliminating addiction as a major health problem. So we work across the United States. We even have some partners outside of the United States. A lot of us work out of Maryland, DC area. I personally am in the Midwest in Illinois, so I'm close to a lot of you folks. And what we really focus on is helping patients and families in crisis. Before 98, we did have a helpline where we had that. We do different trainings. We provide different resources. Like during the pandemic, we created an online digital therapeutics app for people with substance use disorders. We've held support groups. We really tried to provide resources that we wish and trainings we wish were there. We also really work to end addiction stigma. We know that substance use disorders is one of the most stigmatized health conditions in the world. And so we really work through different trainings, education, awareness campaigns to end addiction stigma. We work to advance prevention because we know that in order to kind of like decrease the amount of people who develop a substance use disorder, we need to go upstream. And so that's why I'm really happy that I'm here today to talk about prevention, resources that all of you can access. We also work to increase uptake of evidence-based practice. In case you didn't know, there's a 17-year gap when something is found to be evidence-based. So it goes through a study, it's shown to have the impact that's statistically significant, and it takes 17 years for it to actually be implemented in the field. And so we really work to try to create less barriers for folks. A lot of times it's because maybe folks don't know about the new research. Maybe it's because it's a 100-page research article, and I don't really like to read 100 pages because I kind of get lost. And so we like to create infographics, different materials that really are tailored to the intended audience to get the information into their hands. We create different videos, and you'll see that throughout today's presentation with the different materials that we've created. Another thing that we do is we work to advance research. We really believe in bringing everyone's voices to the table, whether that is different stakeholders like each one of you, or people with lived and living experience, or family members, caregivers. We really think it's so important that we ask those people for their opinions, for their experiences, for their insight, because it goes back to the whole idea of nothing about us without us. So today, the learning objectives, you probably have all read. I'm going to talk about our prevention resources, ways that you can implement it into your place of employment, as well as your community, and how you can access these different types of resources. So I figured it might be good. I'm sure all of you are very aware of this, but in case you're not, why is it so important that we focus on prevention? So we know that 90% of adults who have a substance use disorder began using alcohol or drugs during their adolescence. So before the age of 18. And there's this one study, I'll put it in the chat in a little bit, called the Patient Journey Map that we did at Addiction Policy Forum, where we interviewed a number of people who identify as in recovery. And one of the questions we asked was, when did you start using substances? And of the folks, on average, it was 13 or 14 when they started. The earliest was 5 years old. The latest was 19. And so we know that the brain is still developing. It's very vulnerable at these stages. And so if individuals start using substances earlier, it increases their likelihood of developing a substance use disorder. We also know that 5% of adolescents who start using alcohol or drugs develop a problematic pattern of substance use that meets the DSM-5 criteria of that 11 criteria that provides information about diagnosing a substance use disorder. Another piece that we know that came out of Columbia University is if you start using substances before the age of 18, you have 1 in 4, so a 25% chance of developing a substance use disorder. While if you start using substances over the age of 21, you have 1 in 25. So that is about a 4% chance of developing a substance use disorder. And so I think many times, I know I grew up during the DARE, just say no, don't do drugs. This is what happens to your brain on drugs and stuff like that. But at Addiction Policy Forum, we really believe in providing educational resources so that youth can make informed decisions, because we're not saying, okay, don't ever use alcohol. We're saying, okay, if you wait till you're 21 or older, your likelihood of developing a substance use disorder decreases drastically. We also see through research that when individuals start using substances earlier, they have a lot of different negative associations and outcomes, like higher lifetime risks of adverse effects, mental health disorders, academic difficulties, physical health issues, and cognitive impairments. And one reason why we really focus on prevention in creating resources, just like our Protect the Brain or Protege to Cerebro. Don't mind my not the best Spanish, but that's how you kind of say it, I think, is we know that there is a lack of availability and implementation of evidence-based programs. So it is great when we create resources, but when we create a training, we don't know the intended, like the outcome of it. That can sometimes create barriers. At Addiction Policy Forum, we really believe in when we create materials, we want to get info and information and data to see how does this impact that intended audience to ensure that we're not missing the mark. Another, as all of you are probably very aware, is that there is really a lot of limitations, whether it's financial limitations, maybe there's not enough staff members, maybe there's not enough training. There's a lot of different limitations that folks run into. We also know that many times prevention material is maybe not created to specifically meet that target audience, so they're not developmentally appropriate education. Also, I'll talk about some multilingual resources. Many times it's not in the person's native preferred or primary language, which creates an even bigger gap and barrier for people getting information. And before we created the Protect Your Brain campaign, I was doing some research, and I found on average, if someone wants to implement a substance use prevention program in their school or maybe youth group or different kind of like after school program, it can cost $121 to $300 per student per year, which is lots of money considering how many students are in a classroom. So I am going to have this Slido. We have a couple of different questions. If you can scan the QR code or enter slido.com and enter that number, I would love to learn about where do you currently provide prevention resources. There's a couple of these active polls in here. If anyone runs into problems, please let me know. This is going to create like a word cloud. If you've done Mentimeter before, maybe you're familiar with Slido, but I really like these because when someone puts in their answer, and you can put multiple answers, the more people that put in that answer, the bigger it gets. And so I think it's very fun to kind of see, okay, where are people currently providing prevention resources? All right, so I see colleges, middle schools, schools, health districts, state of Ohio, middle school, community events, mental health clinic, rural communities, outreach events. These are fantastic. Probation, hospital, churches, library. These are a lot of different places that I'm going to be mentioning today. This is fantastic. It's really cool to see schools and community events, because those are two places where we can meet people where they are at and provide them information. So I'll give it just a few more minutes. Youth diversion. I actually had a group reach out to me. They have a diversion program for youth, and they are going to be using Protect Your Brain as part of the coursework or education or kind of like materials that they're going to use for their youth that they serve. And so, all right, fantastic. So I'm going to go to the next slide. Thanks everyone for your participation. So the first program that I'm going to talk about is Protect Your Brain. And so as I go through the different resources today, and as I introduce the different resource, I'd really like you to think about where could I fit this within my current work that you are already doing? Because sometimes we get things and it's great we have the resources, but it's like, okay, how do I actually implement it? And I'm also going to be talking about steps to implement it within different settings and situations. And so like I had mentioned before, why we created the Protect Your Brain campaign, which is an e-course. It's a 30 minutes online, completely free, self-paced e-course, is we really wanted to provide youth with accessible, engaging information about their brain, how it develops, substance use disorders, and really help to increase some of their skills as well as build knowledge. The intended audience for this is about 11 to 17. I'm kind of forgetting how old you are at grade school, but we do have a version that is for grade schoolers as well, because we had some folks reach out and it talks about biological components, how we're we're made to function, to eat, sleep, have sex, protect our young, and they didn't feel it was appropriate to say have sex. So we took that out for that group to be able to use. And so we also have that as well. But what's great about these resources as well is that any caregivers, education professionals, teachers, youth group leaders, coaches, anyone who works with youth can really benefit from this training. Because many times this is information that we weren't told. I know the information in here, I didn't know it until I was taking school, like taking different classes for my degrees, or sometimes information I didn't know until I was working at Addiction Policy Forum. And so it really helps to break down the information. And so some of the key components that are covered within this e-course is how the adolescent brain develops, how substances affect the developing brain. It goes over 4 different ways that youth can protect their brain. It talks about risk and protective factors, coping skills, as well as decision-making skills. And this is a little inside look into the course. As you can see on the left, the e-course starts with a little pretest to ask some questions to kind of gauge where the individual is at as far as knowledge before. And then it goes into a course. It's separated in different modules. What's great about our e-courses, if you haven't taken one of our e-courses before, is you can work on it a little bit, then you can stop and you pick up where you left off. You can go back to it. It also provides you a certificate of completion at the end. And so this is great for schools. Maybe say you're going to make it an assignment or part of a health class or something else. The student can actually email, download, print off a copy of the certificate of completion to show that they completed the exercise. And within the e-course, it has different modes of communication, like it has videos, it has infographics, different reading materials. And so it really helps provide the information in the different forms of kind of communication. Nora Volkoff is my hero as well. She is fantastic. I've heard about her in my associate's degree classes, and then I got to meet her in person, and she is just pivotal. If you have not heard of Dr. Nora Volkoff out of NIDA, highly recommend you check her out. So I'm going to give you a little look into some of the information that is provided within the e-course so you can have an inside look. But all of you today can sign up for the e-course, see it for yourself. I know that I like to kind of get my hands in and look at the materials before I provide it to someone else to ensure that I know what it's talking about and that it's something that I would like to provide to others. And so in the training, we talk about why age is so important. One of the first things that we talk about as a way to prevent substance use disorder and to protect your brain is that age matters. We know when someone starts using substances impacts the likelihood of them developing a substance use disorder. So within this material, we talk about how the human brain is fully developed in our 20s, which many people don't know that. The brain's prefrontal cortex develops at about 25 for boys, while the female brain typically matures around age 22. To prevent addiction, it is critical to understand that the adolescent brain is more vulnerable to alcohol and drugs than the adult brain. This scan illustrates a healthy brain development from 5 years old to 20 years old. The blue represents the maturing areas of the brain, and the red and green and yellow areas are the great synaptic activity, rapidly developing and learning in the brain. Children with developing young brains can learn things much more easily, a new language, a musical instrument. They learn it much faster and easier than adult brains. But the plasticity, which makes it easier for folks to learn, means it can be harmed more easily. And so by presenting this information, we're educating the youth on this is why. This is why you can learn things more easily than someone like me, but it also is why your brain is more vulnerable. We also talk about risk and protective factors. We talk about the three different factors that contribute, because one of the thing is individual factors like the age of first use, like we were talking about, but it also has many different other components, your genetic makeup, the environment. And so we introduce that at the individual level, different risks include early onset of alcohol, other drug, marijuana use, history of trauma or abuse, mental health disorders, as well as maybe lack of parental monitoring or kind of like rules or consequences within the household or expectations. Then we look at environmental factors. This can be maybe drug availability. We know that high risk environments include high drug availability. Also, we know that maybe the substances that are available in Chicago are different than in California. And so that also is something that impacts the likelihood of someone developing a substance use disorder. We also know poverty, crime, when it's normalized to use alcohol or drug use. So adolescents feel it's normal behavior, which can happen in the family or community. This increases and is a risk factor. This is an example, maybe mom and dad come home from work and they drink a beer every day. So it's normalized that the youth see, okay, when I come home from work, I drink a beer to relax. Or when I go to parties, I engage in marijuana smoking or cocaine use. And so it normalizes, so the youth thinks, okay, this is what adults do. Also, if parents are using substances, peer pressure, we know all of those are risk factors. The other risk factor is genetics. So if there's a family history of addiction, family studies suggest that as much as half of a person's risk of becoming addicted to nicotine, alcohol, or other drugs depends on their genetic makeup. And so, although my parents don't have a substance use disorder, I have aunts, uncles, grandparents who did. And so I have that genetic load. I have a son, and his father, as well as me, are in recovery from a substance use disorder, but because of his genetics, he is much more likely to develop a substance use disorder. And this is not all doom and gloom, because the thing is, if we know these risk factors, we can counterbalance them with protective factors. And I'm going to put this video, I'm not showing the video just for sake of time today, but this is a fantastic video that Jessica Holsey, our executive director and founder of Addiction Policy Forum, put together. And she shares her personal experience. Both of her parents had a substance use disorder. And really she talks about how she had these risk factors, but she had all these protective factors that counterbalanced it. And so today she does not have a substance use disorder. She's very mindful of when she drinks, but she does not have a substance use disorder, and really attributes it to the counterbalancing of risk and protective factors. And for me, this video gives me so much hope, because I know that if I kind of like counterbalance the risk factors of my son, that he doesn't necessarily have to go down the path that I went through. Another piece, another piece that is we cover in the training is adaptive and maladaptive coping skills. Maladaptive coping skills are harmful coping strategies, and scientists describe it as disengagement targeted to avoid stressful situations or the related emotions. And so we know maladaptive coping skills is unhealthy, negative behaviors that often work quickly to numb or regulate emotions, which generally increases stress and anxiety down the line. Then we talk about adaptive coping skills. So counseling, exercise, meditation, journaling, art, painting, talking to someone. And we also talk about maladaptive coping skills. And so this sometimes is really great to introduce, because sometimes folks, even adults, don't realize maybe they're utilizing some of these maladaptive coping skills. And I always think, okay, if we identify a problem or something that maybe we don't want to engage in, we need to look at what are alternatives that we can utilize. And one other piece that I wanted to cover that we talk about, and we also have a one-pager that you can download for this, is we talk about practicing refusal skills. We know that teens are going to be in risky situations. We know that youth are going to get offered alcohol and drugs. In a perfect world, they wouldn't, but that's not the reality. And so we recommend practicing key messaging that teens can use in risky situations. Within this training, we talk about, for example, a conversation about how to respond to offers from peers or others to drink or use drugs with specific responses can help prepare adolescents for those situations. And so we introduce 5 different categories of refusal skills. And we also have an explainer video within the training that really talks about these. And of course, we always tell youth, no is a complete sentence and a complete answer, but we want to provide some additional opportunities for youth to think about different ways that they can say no. So that is an inside look into Protect Your Brain e-course. And now I'm going to talk a little bit about this pilot study that we did. So we created this curriculum. We wanted to make sure that it had the intended audience or intended impact for the audience. So this is a little look. We conducted a pilot study last summer, and it was really great because we had high school students that were interning with the summer. And so they really helped review the curriculum. That's one thing we do at Addiction Policy Forum is if we're creating something, we want the intended audience to give us feedback. If the graphic is ugly, we want to know. If the words are too high or too low, we want to know. And so it was really great to have these interns help us to review the materials, talk to their friends about the materials, and then they helped us recruit, as well as many of our community partners. I know some of them are on this call. Prevention Action Alliance also helped, and we recruited folks to take this. And so they took that pre-test, completed the course, and then they took the post-test. And what was great is that we saw that on average, folks went from about a B to an A+ overall. And you might think, okay, that's only a little bit, not much. But in reality, this is a 20 to 30 minute course that folks are taking. And what's even more reinforcing of the data, seeing that it went from a B to A+, is when we look at the actual questions that folks had an increase in knowledge around. And so on the screen, you can see one of the questions was delaying the onset of substance use is key to preventing addiction. So the answer is true. So at the pretest, we had about 75.6%, so about a C. And then it was an A on the post-test. And so that's one of risk factors that folks don't know about is delaying the onset, not completely not engaging in substances, but delaying the onset. Another one is the adolescent brain fully matures by age 18. We had 68.9%, so you have a D, and it goes up to a higher B. And then genetics are a risk factor for developing a substance use disorder. Went from a D to an A. Those are all key pieces for adolescents, youth, family members, anyone who works with youth to really be educated on how they can protect their brain, and really what are the risk factors for developing a substance use disorder. So we took this curriculum, and this past year we released this curriculum in Spanish. And so this is Protege to Cerebro. We translated the pre-test, and the little like test, the little questions within the actual course. We translated all the infographics, the videos, all the materials, and like we utilized youth to review the curriculum, we utilize other folks who speak Spanish to make sure that the translations were accurate, make sure it was culturally responsive, it was appropriate, because we really believe we could translate something, but if it's not in the language that folks use, it's going to miss the mark. And so we had a team of different individuals to review the materials to really make sure that we were using the best language as well as best infographics, images, and different pieces. And then this is one other look into the e-course. And so now I'm going to go over a couple other resources. These are, we have a whole list of resources. Today, if you're on Addiction Policy Forum's newsletter, I can't remember if it got sent out this morning or it's getting sent out today, but our whole newsletter today is focused on back to school resources for parents and educators. It is a whole host of different prevention materials. I also want to note that what I'm covering today is some of our materials. We have so many more, but I would not be able to cover all the materials. What's also great is all of our materials are free, open source. You can utilize them, so that you can really implement it within your field. We know that there's a lot of lack of, maybe we want to create certain materials, but we don't have the time, the resources, the finances. And so instead of having to reinvent the wheel, you can utilize our resources, and they're reviewed by researchers, they're science-backed, reviewed by the target audience, just to make sure that it's hitting the mark. And so our vaping, the Hit Your Brain Takes, this is one of our educational campaigns. It aims to correct misinformation, explain the health risks of adolescents vaping, and empower schools, parents, and students to take action. As the real risks of e-cigarettes and vaping remain largely misunderstood by adults and teens alike, the campaign boils down the latest research into digestible formats for teens, adults, by looking at the problems caused by vaping and strategies to address vaping. And so what's great about this is we have like an actual PDF you can download, that has fact sheets, lesson plans, school policy recommendations, different educational materials. But there's also videos. We also have an e-course that is created for youth, as well as an e-course created for parents. And so that also is another way for folks to engage with this information. Again, those e-courses all produce a certificate of completion, which really the youth can utilize to turn into someone, show that they've completed it. Also, it's kind of like, I completed this. I think sometimes when I get certificates, it makes me feel good that I completed something. The next part is the opioid prevention campaign. And so I'm going to go into the middle of the little pieces that are included in it. The first part is the 12 things parents can do to prevent addiction. There's a workbook, and there is also a video. And this offers practical, research-informed strategies parents and caregivers can use to strengthen the protective factors of their youth, improve communication, and reduce the risk of youth developing a substance use disorder, sorry. We also have one-pagers on addiction in the brain. These are two different one-pagers that we have. As you can see, these Prevention Action Alliance had joined us when we launched these materials. And so we actually have these that are co-branded with Prevention Action Alliance logo on it. Sometimes, as Prevention Action Alliance is all of y'all's trusted messenger, sometimes that helps with presenting information to different folks. And so one of them is an infographic really talking about how addiction hijacks the brain, how it impacts everything, and another informative one pager on addiction in the brain. And so it really talks about the brain's reward system, why substance use disorder is recognized as a chronic health condition. Then we also have a one pager on teens and opioids, as well as a video. And so this helps understand how opioids affect the developing brain, why misuse is especially dangerous for young people, and how to make safer, informed decisions. And then this is the one pager that I was talking about. We talk about refusal skills within the Protect Your Brain e-course, but we also have a one pager that you can just print out and have and provide to other folks. We also have a video, 7 things teachers can do to prevent addiction, discover 7 practical strategies educators can use to strengthen protective factors, foster supportive school environments, and help prevent opiate misuse. And one thing that I really like is we also have a partner toolkit for all these materials. And so a partner toolkit is one way that whether you want to share it on your social media, put it within a newsletter, put it in an email, we have created little blurbs, little things that you can utilize to kind of like lift some of the work to do it. We've created graphics that you can utilize. We really want to make it as easy as possible for you to share with everyone within your network or folks that you work with. Another thing that we have is a video. We came out with this, I think like 2 years ago. It's called Facts About Fentanyl and Understanding the Risks. As we've seen more fentanyl over a number of years in the supply of different counterfeit pills and different substances, we thought it was really important to educate folks on what fentanyl was and how it provides like a higher risk for someone. And so this provides important information on counterfeit pills, the risk of fentanyl exposure, and steps communities and families can take to prevent overdose and substance use disorders. And as you can see, a lot of the materials we've created are to inform folks, but it's also to correct some of the myths and misinformation that folks have heard over time, or have been told by someone or have just come to believe. And this is one of my favorite videos that we came out as well. This is What is Addiction? And what's great about this is it really walks through the science of addiction for family, caregivers, community members, students. It talks about understanding addiction through a health lens, which helps in the treatment of individuals with substance use disorders with empathy and promotes more effective prevention and treatment strategies. It really goes into how addiction has biological components, such as it affects the brain, as well as psychological and social components. And so it provides information on the 3 domains of the biopsychosocial response, and it recognizes there's multiple pathways to addiction, such as genetic predisposition, psychiatric and psychological factors, and unhealthy coping skills. And then the importance of when someone is getting treatment for their substance use disorder, clinicians need to work to create an individualized plan tailored to the unique needs of each patient and each of these domains. So when someone receives treatment, it's so important that we look at biological, whether they have any physical health conditions, mental health conditions. Then we also need to look at psychological factors, and we also need to look at social aspects. Then something that I think is amazing is we create all these resources, but then there's lots of different populations of people whose primary or native or preferred language is not English. And so they're not getting these resources. And so we are really grateful for the opportunity to translate all of these materials into Spanish. And so you all are able to access these materials in Spanish as well. And then the next year, we were able to translate these materials into, I think now we have 13 total languages. Most of the materials and videos are translated. The facts about fentanyl, the what is addiction, all is translated in all of these different languages. But this is really great because we're able to target different audiences, provide this evidence-informed information to folks, and really to decrease some of the barriers that folks run into. So I'm just going to run in a couple examples of the different materials. We have Arabic, Bosnian, Burmese, Chinese, Dari, French, Pashto, Somali, Swahili, and Tagalog, and then Ukraine. And so one thing that's fantastic about this, of course, with the videos, you're not able to do it as much, but these resources, because a lot of them you can print off, English or any of these languages, you can actively pass them out, like intentionally pass them out, but you can also passively pass them out, like leaving them within a faith community. They can have them sitting on a table somewhere so that folks can go up to it and take it themselves rather than you intentionally passing it out. And sometimes people are more open to receiving materials when someone is not directly giving it to them. And so this has been fantastic to be able to kind of provide both sides of it. And so now I'm going to take a pause. And so thinking about these resources, we're going to do another poll or word cloud. Who do you think you could share these resources with? Teens, youth aging out of care, schools, parents of youth we serve, coworkers, community partners, everyone. Yep. Mentors, parents and caregivers, my team, coalition members, school counselors, parents of athletes. Yeah. Yeah, we have, so at Addiction Policy Forum, we have this training responding to addiction and Encompass, and they've both been found to increase addiction knowledge and decrease stigma among attendees. And we have over 500 instructors now across the United States. In Ohio, I think we have over 200 instructors. So if you ever have interest in having one of these trainings, please let me know. I'm happy to connect you to an instructor in your community. There might be one that's already hosting trainings. But a lot of those individuals were providing this Protect Your Brain, and a lot of the folks were talking about after school programs, football camps, karate, youth groups. There's all sorts of different kind of places where we can provide this information. All right, thanks everyone for your participation. So now I'm going to go into a couple of the different settings in which we can integrate this information in. So first, we're going to look at schools. We're going to look at students because I want to look at students, but I also want to look at parents. And so and I'm going to show like kind of like a formula on how to like help integrate things that maybe you're familiar with, but maybe you're not. But one of the things that we like to do is to really look at, okay, in the school system, what are we already doing around prevention, health, wellness? Can we incorporate this into it? Can we provide Protect Your Brain e-course as something that they do part of course curriculum? Is this something that we can use during a lesson that we already are doing? Is there advisory periods, maybe like a free period, or maybe if a student has a detention, is this something we can provide them for them to do? As well as can we incorporate some of these materials or kind of put out some of these one-pagers or infographics at wellness activities? Also, can we partner with schools to identify opportunities maybe for your organization to provide this prevention education to them, whether it is through maybe I know my son's school has a lot of these parent workshops. Maybe we can provide it at the parent workshop. Maybe we can, I know when I was in high school, which was a while ago, we had health fairs. Maybe we can do it at a health fair. We can come in and talk to students that way. Thinking about, okay, how can we incorporate this already into what we're doing, or how can we help bridge this gap for the school system because we're not directly in the school? The next thing is thinking about how can we integrate this in schools with parents. We can share this e-course, infographics, any of these materials with caregivers, students, teachers, school staff. The more people that know about it, then they also share. So it's that ripple effect. I also think it's so important for teachers, school staff, anyone within the school system to know about these resources, because sometimes whether it is someone that's working in the lunchroom, a janitor, maybe they're seeing things that other folks are not seeing. And so providing them with this education and resources, maybe they can be that person that provides this information to that student. Also, we can include these resources in school newsletters. Maybe there's a caregiver or parent portals. We can put it in there so that folks know that this is free, accessible information that they can access at any time. Back to school communications. And then we want to be sure that we equip counselors, school, social workers, nurses, educators, school staff. So we want to equip and provide this information to all these folks. And one great thing about the Protect Your Brain campaign, and this is in Spanish as well as English, we have one pagers, which is great, whether you add it into a newsletter, or you provide it to a student, you provide it to a parent, you could have it displayed somewhere. And we also have a how to sign up for the e-course. And so that is also in Spanish and English. We also have one that has Spanish on one side, English on the other side, to really walk through the steps for accessing the e-course. And what's great is if someone signs up to do the Protect Your Brain e-course, we have a whole host of different e-courses. And so then they're going to be able to see those as well and access all of those for free as well. The next thing that I wanted to talk about is how do we integrate this into healthcare settings? And hopefully this image, I was trying to make it look more, I don't know, make it look better rather than just words on a screen. But one thing that I thought was really interesting is thinking about, okay, we have all these different intercept points when we can provide educational resources. And this is, it can be actively, when the doctor is talking to the patient. It can be passively at the waiting room. Maybe there's flyers, QR codes to look up something. I know some waiting rooms have videos that are playing. And so really looking at this, okay, before the visit, can I house some of these materials in the patient portals, maybe on our website, maybe digital resource libraries at the point of care when they're going in to receive the care, maybe in the waiting room materials, flyers or pamphlets, maybe QR codes. During the visit, maybe the provider have conversations about this. Maybe they can do an assessment to kind of gauge. I think it's so important that we start talking about it with youth about substance use earlier to really bring awareness, as well as providing additional support or resources. And then we can also provide these resources and education, whether it's in the setting or materials for them to take home and review. And then looking at after the visit. I know every time my son goes to the doctor, we get this discharge paperwork and there's all these resources. Is there a way that we can add it into there? Is it a way we can follow up with them to provide them more resources? And then this is all thinking about like the initiation of healthcare and following up with a visit. But we also want to think about beyond the healthcare setting. It's so important for us to know about community referrals. Where can I point a parent to gain more information about this? Where can I direct a youth, maybe that is starting to use substances and is open to talking to a counselor? We also want to know about behavioral health, emergency rooms. And I think it's ever since I've entered the field, networking and collaborating with others is so important because the more hands in the pile, the lighter the load. And I think it really takes a village. I was watching a video the other day, I was talking about it takes a village to raise youth. And it really does. All of us need to join in and really help carry this load to really decrease the number of folks that are inflicted by this disease. Then how do we integrate this? Maybe you work at a community coalition. One thing that when I was thinking about this presentation and kind of like how we approach things at Addiction Policy Forum is the importance of when we're thinking about maybe creating a new resource or something like that. First, we need to assess. We need to look at the needs of the community, look at the needs of the specific audience, as well as the data. What is that showing? Then we look at select. So we found the needs, the data. Now, what of the prevention resources would best provide information to this group? Then we need to go to equip. Maybe we need to train coalition members. Maybe we need to train partner organizations on the available resources. Maybe we need to provide them with these resources. And then we want to look at coordinating. It's so important that we coordinate messaging so multiple organizations are reinforcing consistent evidence-informed prevention information because it's really challenging when one group's saying one thing and then another group is saying another thing. I think that's what's sometimes like the internet is so great, but there's so much that maybe is misinformation out there that it can be really challenging to know what is accurate and what is not. And so, coming together, making sure that everyone is providing the same information is really important. And then it's always important to evaluate. We want to see, okay, is this missing the mark or is it hitting the mark? Does it have an impact? What is the feedback from different people who have utilized these resources? And you can also add the different resources, whether it's to coalition toolkits, events, use it within social media, in already existing campaigns. And then how do we integrate it within community organizations? So I think when we look at integrating it into community coalitions, it's like, how can we provide this information to others to utilize? You can utilize it within your own community coalition, but also how do we provide this and be kind of like a resource library to others in the community? While looking at community organizations, how can we actually use the resources within what what is already existing and what we're already doing? And I think the most important thing is remembering, how can we meet people where they are and where we are currently seeing them? And so I saw a lot of this in the prior word cloud that we did, while providing prevention resources at events, maybe community events, workshops, digital access, social media, QR codes, the importance of language access, making sure it's preferred language and culturally responsive resources, integrating into existing services, existing programs, whether a youth and family program. And then I really loved seeing, having it in community spaces, libraries. Someone had mentioned libraries, recreation centers, community centers. And this last part is trusted messengers. And so I had introduced this a little bit earlier. So Prevention Action Alliance is a trusted messenger to all of you. You are here to receive information because you have probably received a lot of different information from Prevention Action Alliance. Maybe you partnered with them and worked with them for a period of time. And so you trust the information coming from them. When providing this information within the community, it's so important to look at the trusted messengers of those people. And so, for example, some folks, their trusted messenger might be a faith leader. So making sure that we talk to faith leaders and engaging them within this prevention work so that they have this information to provide to the people that trust what they are saying. And then this is another way to kind of look at how to integrate. And then it's a little bit similar to my next slide. But when we integrate, we want to think, okay, how do we integrate into existing programs and services? How do we share? Can we share it on websites, through QR codes, flyers, social media? How do we engage? How do we actively engage with someone, talking one-on-one? Sometimes having that one-to-one communication can be really helpful for people. And then sustain. How do we build this into services or into like a system so that we can keep doing this to sustain it? And then overall, when we're thinking about, okay, this is my role, this is the organization I work with, this is the audience that I work with, I think the most important thing is to think about, okay, identify the resources that are needed for the audience. So again, looking at the needs, looking at the data, then determine where the resources fit into maybe an existing program, service, curriculum, or workflow, or where you can maybe add it onto or create a new piece for it. Share. We need to equip the people who will introduce the resource. Maybe these are educators, healthcare providers, coalition members, families, trusted messenger, community leaders, and then integrate. Build the resource into something you're already doing rather than creating something entirely new. And then evaluate. It's so important for evaluating. And if we're ever trying to create new resources or share resources, it's always great to also ask the intended audience, what did you like about this? What do you not like about it? What would you recommend to change? And so before we open up for questions, I have one more word cloud. What is one action you can take to integrate or share some of these prevention resources today? Today or the next week? Print off, share with family, share. Integrate into upcoming initiatives. Yep. Share with coworkers, print a flyer, share at schools, post on social, share in class. These are all fantastic. And I'm putting a couple resources. One that I did not cover today is our addiction series. I think these videos are fantastic. They're really easy to understand. And so check out the addiction series. And then the other one, the back to school resources, that's what our newsletter is focusing on. And it has a whole host of prevention resources, some I didn't even mention today. That's just great. And it also gets you in to see what other kind of resources. Also, if you ever run into a situation with maybe you would like a resource, but don't know if we have it, please reach out to me. I'm happy to connect to share what other kind of information. If we haven't created it, maybe we know someone who has created something. Fantastic. All right. I appreciate everyone for engaging in the Slido. And so I will go to the next slide and then I will stop sharing.
Kayla, this has been absolutely fabulous. Thank you so much for sharing your program and your insights and information with us.
You are so welcome. Thanks for giving me this opportunity and for your continued partnership.
And thank you everyone for attending today. We appreciate you taking time out of your busy schedules to learn more.